Today, I'm going to be talking about what could be causing your low back pain. Dr. Ammon Hills, I'm a pain management physician, and one of the most common reasons I see people for is low back pain. So a lot of times we use low back pain as just a general term describing that someone has pain in the low back region, when really there could be many things going on in that area. And so today we're going to run through some of the common and less common reasons that someone may be having low back pain. So let's just jump right into it. Most common cause is a torn or pulled muscle. We can classify this as myofascial pain, meaning there's some of the soft tissues that are irritated or inflamed. So these are the structures that are just on the outside of these bony landmarks in the spine. A lot of times that can cause low back pain for people. A lot of times this is improved with physical therapy and other conservative treatments, but sometimes they will require more advanced treatments as well, which we perform in the office. So next, if we look here, these blue structures are the discs in between the bones in the low back. And so those can be a source of pain. So a herniated disc is something that you've probably heard when someone's lifting something heavy. That can cause this disc to bulge out, and that can be a source of low back pain. For other people, when they get older and their spine starts to become more arthritic, then the space in between these bones where these discs live can actually degenerate. So that brings us to number 3, degenerative disc disease. So that can also be a source of low back pain. As we look at the bone itself, so there's something called a vertebrogenic back pain. A lot of times we'll see this on MRI imaging. We'll see some edema or swelling within the bone here, and that can also be a source of low back pain. Next, we have FACET joint syndrome, or FACET pain. What that means it's the joints in between the vertebrae in the spine. So you can see as we move the spine that there's some movement there, right? It moves because there's joints between each of these vertebral bones. Those joints are called facet joints. And so those joints can be painful both within younger individual as well as older individual. It's a little bit different. So younger individuals, after like car accidents, when they have these hyperextension flexion injuries, can cause inflammation and pain at these facet joints. Whereas with the older patients that maybe have a more arthritic spine, those can also become painful and irritated, just like they may have a painful arthritic knee, can have a painful arthritic back. And that's really what the facet joint syndrome is about. When we're looking at the space where the spinal cord is, right, then we start talking about if that space is getting squished, then that's what we call spinal stenosis. And spinal stenosis can also be a source of back pain, can also cause leg pain as well. Also, looking at the spine here, one thing that we need to take into account is if there was a fracture. And so the back can actually fracture in a couple different areas. Again, for our older patients that maybe have a little bit weaker bones, osteoporosis or osteopenia, where their bones are becoming more fragile, the vertebral bodies themselves can fracture. So this can happen with flexion movements, as well as car accidents, falls, even minor movements can really trigger these types of fractures, which can be extremely painful. If it's a younger patient, for example, like in gymnasts where they're doing a lot of back bends, then they may fracture a different part of the spine, which may also be pretty painful. So another thing with fractures is sometimes there could be a dislocation. This would obviously cause more impairment, usually associated with other signs like numbness and weakness, and need to be seen immediately for things like that. So if this was dislocated, then that would be a very bad thing, but could also be a cause of low back pain. So we also look at the alignment of the spine. And so the alignment can be off a few different ways. So when it's off left to right, we call that a scoliosis. And that can also put more pressure on the joints and other structures, resulting in low back pain. The other is, that we talked about with the dislocation, is if the spine has moved front to back, then that alignment would also be off and create a potentially unstable spine, which would need to be fixed. So looking at some of the structures just outside the bone, so in between each of these parts of the vertebrae, there's going to be ligaments, and those ligaments can tear, they can also get inflamed, and so there can be pain coming from the ligaments themselves. There are some people that have an extra vertebrae or just slightly different vertebrae anatomy compared to other people. We can call that something called like a Bertolotti syndrome. It's actually a name that describes low back pain caused by that different anatomy. Another cause of low back pain, which is maybe a little bit more common, is there's some nerves that come off the upper lumbar area and they cross over the pelvis down lower. But those nerves are called the superior cluneal nerves. Those can actually get irritated and cause low back and kind of buttock pain, often forgotten cause of low back pain. So I've had a lot of patients actually who have had a lot of other treatments, a lot of other procedures done, back pain just not getting better, and then when we block these nerves, that helped them tremendously. There's an actual name for this, MAIGNE syndrome, which is describing the irritation of those cluneal nerves. So another cause of low back pain that we hope isn't happening and is a dreaded cause would be cancer, right? And so if there was cancer that had spread to the back or to the spine, then that could be a cause of low back pain, usually associated with other signs and symptoms, usually really gradual. Could be associated with a fracture, could be associated with weight loss, and if there is a primary cancer that's known to send metastases or cancer to the spine region. And then if we look a little bit lower on our model, we know that there's a joint in between the sacrum and the pelvis bone called the sacroiliac joint or SI joint. And that's also another common cause of low back pain. Can often confuse us when we think the pain's coming from somewhere else and it may be coming from that SI joint. And so again, if you're wondering where your pain could be coming from, go see your provider or someone like myself that can help you out. So if you have any questions or comments about low back pain, please list those in the comments below. If you want to see another video about low back pain, click this video right here. Don't forget to subscribe and I'll see you next week.